Good evening and welcome to In Focus on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, Executive Director of Whitewater Community Television. I know you're not used to seeing me in this seat. It has been a number of weeks. The last couple of weeks have been programs that were reruns that Eric Van Vliet did. Eric opened the year with a new show, and Phil Quinn sat in for me the last live show of December. So Ryan was asking me in my head when was the last time I did this. It may have been close to election time, so very late November. So glad to be back, glad to have taken a break, and very happy that you're able to join us as we start what will be a series of conversations that we have next week, and we'll mention this again near the end of the show. We've got members of the Richmond Common Council that have been invited in 2 weeks. Sheriff Jeff Kappa and Police Chief James Branham will be joining us also. So we've got a number of shows that will be coming up here over the next few weeks. We'll remind you near the end of the show about next week's program, which will be a special 90-minute program. We love doing those because we will have a number of people here to talk to. But we are going to open this show by talking about Reid Health, obviously one of the larger employers in the area, one who takes care of us healthcare. Incredibly important conversation locally, statewide, and also nationally. Happy to have back with us Craig Kinyon, President and CEO of Reid Health. Thank you for being here.
Evening.
And Dr. Rohit Bawa is with us, who is a gentleman that's very happy because he's just recently moved into some brand new digs on the corner of Waterfall Road and Chester Boulevard that is actually where the Pediatrics and Internal Medicine Center used to be. Cleared that land, renovated a building, moved them, built this one. You all have a lot of building and moving and shifting going on. How do you keep up with all the pieces?
It's really the second part of the Renaissance when you think about moving up the street from our previous location for over 100 years. Now our campus, that with the whole change in physician recruitment and physician alignment, which was not a local issue, it was a national issue. It's all about retooling those buildings and aligning them for the next 40 years and making those changes. So it's been a very busy 5 or 6 years.
It has been, and this new location will provide some interesting and better accommodations for your business and those that are joining you. And let's start with a little bit of your background, where you were and where you're moving from, for those who may not know that.
Sure. First of all, I'm an ENT physician, and a lot of people probably do not know what ENT actually means and does, so I'll explain what ENT is. You know, we take a lot of care of a lot of things in the head and neck area. Ears, hearing, ear infections, and ringing ears and dizziness. We have 2 audiologists who are PhD trained providers who diagnose and evaluate for hearing loss and sell hearing aids. That's an important part of the practice. Okay. We were in an old location. It was a small location. We were cramped in that location, so that's why we moved to this new big location. ENT also does nose issues, nose, sinuses, allergies. We have a full-time allergist, Dr. Jason Castleman, who is an allergist who all he concentrates on allergy. He has the one side of the new location is audiology, which is hearing, and allergy, and with those providers. The other part of the building, the new building, is just purely ENT, which is ears, nose, throat, neck. We take care of neck tumors and thyroid diseases. We take people who are hoarse, have trouble swallowing. We do scope exams. So there are a lot of different things which ENT does. We also do skin cancer surgery, facial skin cancer surgery, thyroid removal. So this allows us to expand our practice base. Not just locally but regionally. We are actually a regional practice. You know, the closest ENTs other than us is basically you go to Cincinnati or Dayton or Muncie or Indianapolis.
Really?
So our practice has other regional satellite offices in surrounding towns. Greenville, for example, Winchester, Newcastle, Connersville, even Rushville. So we have a regional presence. So this allows us to expand in Richmond, and also give us a regional presence for ENT itself.
Okay. The practice that you had, which was on South A Street with 2 other physicians, Dr. Hirons, Dr. Jetmore, who have retired, was all of what you're doing now in this new location in your previous facility?
Yes. Well, not all of it. A lot of it we were doing, but we were doing it in a very cramped manner. We were not doing it, I don't think, it is as high quality as we could have done it. We would do the bits and pieces of it. We did some allergy, we did some hearing, but not as much as we would like to have done, and we didn't have the space to do it. So now with the current location, we can expand all those services, and we can also expand into new services. We're going to start doing a procedure called balloon sinuplasty, which is an office-based local procedure where you can go into sinuses and balloon them open. People who have a lot of sinus problems. Okay. The only treatment option right now currently is medications or allergy treatment or surgical treatment. But now we have a new opportunity, a procedure which can be done under local anesthetic in the office to open up your sinuses. That's just one example of the new things which we are bringing. We have new microscopes to look in the ears. We have new scopes and monitors to be able to look in the throat and the larynx. We have equipment now that the patients actually can see while I'm doing an exam. You know, in the past, only I could see it. Nobody else could see it. Okay. But now, actually, the patient and the family sitting right next to him will be able to see exactly what I'm seeing right then and there. So there's new technology to be able to do all of that. So we are expanding our technology for patient experience, for improved patient safety, for more quality, and again, as I said, for mostly patient experience.
Aren't patients a little squeamish when they start looking inside their bodies?
Well, you know, that's how some are not. Actually, give you an example, when we do procedures in the hospital, there's a surgery center in the hospital, Reid outpatient surgery and endoscopy, we put tubes in kids' ears. The way we've got it set up, when I'm doing a procedure and putting a tube in kids' ears, the parents are actually watching what I'm doing. So there's some history behind it in our practice, so they can see it. We've got it set up so the same thing is going to happen in our current location. Obviously, if somebody doesn't want to see, we're not going to force them to see it. You know,
sure.
We're going to obtain the consent to make sure they're okay with it. But a lot of people actually would like to see it. You know, I think it's easier as a patient to understand what's happening if you have a visual. I think just talking one by one that you have this going on, sometimes they don't understand it as well. With the visual, you can understand it better.
Even better than an X-ray or something along those lines.
Exactly.
They can
it's
really kind
live.
of see what's going on.
Exactly, right.
How has the technology through the years changed how you do what you do and your interaction with patients in that way?
Well, technology in medicine in general has advanced significantly. Advanced in imaging, in how you can see things, and the scopes. And not just ENT, but a lot of other places. ENT specifically, through scopes, we can look at small areas a lot better. We can look in the ears, we can look at the nose, we can look at the sinuses, and we can operate through micro instruments in different areas which we couldn't operate before. So the technology, because of optics and digital technology, allows us to have the new scopes which allow better visualization, so we can see better. And we can see better, we'll diagnostics better and treat better.
You've only been in the new location for, barely a week. You moved in this past Monday,
Correct.
Actually, right?
Correct.
Did everything come with you? Is the new building now actually empty?
The old building,
empty?
We did buy a lot of new equipment, because some of the equipment which in the old building, because the practice with my two previous partners, Dr. Jetmore came to town in the late 70s, so some of the equipment was quite old. Okay. So some of that equipment did not come with us. So, but some did, but a lot of the equipment, most of exam rooms is actually newer equipment. Some of the scopes and everything which we had, we brought over, but we also have some new equipment also.
And we're seeing
this is an example of on the left is what's called an SMR cabinet, which is a cabinet where we store different supplies and different things, and a chair for patients to sit at. ENT is a type of, especially where you're basically sitting. This is an example of a procedure room. We actually have now 2 procedure rooms. In the old building, we only had 1 procedure room. So now we have 2 procedure rooms, so we can do more procedures. The procedures can be done simultaneously by 2 different physicians, which procedures include skin cancer surgery, include scopes in the nose, include, which I talked about, balloon sinuplasty. So that was just an example of the procedure room in the building.
What's the area of this new building that you enjoyed the most so far? And again, it's relatively new to you, but
Well, what I enjoy the most is the fact that it's much more open, and the workflow is a lot easier for both myself, my staff, and for the patients. The other thing which I enjoy is the equipment is definitely state of the art. So when I'm using a piece of equipment, it's as state of the art as can be, and so I can see and look into patients using that equipment a lot easier, a lot better.
Okay.
This is an example.
Explain this room.
Okay, this is a allergy area. So these are all different chairs. There are curtains around this, so there's privacy for patients when the patients are being tested for allergies. Allergy testing is done with tiny pricks in your back, or sometimes in arm, mainly in the back, by Dr. Castleman, who's an allergist. And then patient coming, if you have allergies, you can come in on a weekly or every other week for allergy shots to get desensitized. So this is where patients come in for the allergy testing and shots and treatment.
Okay, and we have one more.
And this is a example of an audio booth. We have 3 audio booths, audio meaning hearing tests. So this is where the hearing tests are done. These are very thick walls, very heavy booths, so it has to be a soundproof booth so to be tested. So we have complete 3 new booths. The other thing which we are expanding in the new building is pediatric audiology. We always were doing adults, but now we have more equipment where we can do pediatric testing all the way up to newborns. And by state law, every single child born gets a newborn infant screening done for hearing. And in the past, if they would fail it, they would have been sent to Indianapolis, either Riley or St. Vincent's, for further testing. Okay, now in our building, we've got equipment to be able to do that testing here, so patients don't have to leave town. So we've tried to bring things locally for local access, and so people are not leaving town. And then this provides not just local enrichment, but on a regional market.
We started by talking about one, moving into this new location, and some of the shifting that went around in order for this location to be built. Across the street, almost from this, well, across the street, I think there's a parking lot, but we'll talk about that in a minute. Reid Urgent Care is going into that corner. What was the decision behind making that move from the location that they're in? And they've been working on that building. That renovation seems to be, for somebody who drives by it a lot, incredibly extensive, inside as well as outside. And I didn't really know what was going in there until you put your name on the building about a week or so ago.
Sure. That building has been around for a number of years. It used to be the former cardiologist building back several decades ago. So it needed to be updated on the outside. The exterior needed some work, and this was an opportune time to take care of that. On the inside, it actually has 2 levels. So there's a lower level and a ground level. The ground level will be all urgent care. The lower level will have 4 dedicated dental rooms. Now, dental services has been a long need in this community for those that are indigent or don't have insurance. So we've been providing that in the current urgent care space in its current location now, but you had to take some other rooms out of service to do that. So when you're doing the dental clinic on Mondays, you had to take those rooms out of service for acute episodes or people coming in sick. Okay. And now we'll have a better flow because we have a large demand in this community for dental need. Now we can put that in the lower level, so dental will have its dedicated space. It doesn't necessarily need to be limited to just 1 day a week. And the upper level in the new building will all be urgent care. And that will all be changed to adjust the flow for that, because we've been in that space, or currently in, for years. We actually inherited that from another provider, so we've left that alone for several years. So these moves give us an opportunity to not only change configurations and flows, but now to adjust to the size of the capacity and the need. So urgent care has been a growing need. We've been continuing to remind the community we have urgent care. You can go back several years ago, there wasn't urgent care. There were physician offices, and when they closed, you had the emergency room. Right. So urgent care has now come online as being the less expensive alternative for lower acuity care. And we've also expanded into the Meyer store for Reid Ready Care as well. So that level of capacity now goes 7 days a week.
Okay. As you talk about people using the emergency room for their urgent care. Once they've gotten used to that, how do you break that? And are there the physicians and others in the community now that can fill the capacity for what you need?
Sure. Well, the urgent care has filled some of the capacity need, and part of that was moving some of the lower acuity care that was coming into the emergency room that didn't need to be in the emergency room, and putting that into a setting like urgent care, which is less expensive, and you don't need the heavy capacity of an emergency room for low-level care, acuity 1, acuity 2, sniffles, sore throats, things like that. So that's been readjusted. Now,
but how do you break that in people's minds? That's where they've gotten used to going.
Sure. Well, there's a significant cost differential. So going into the emergency room is a very expensive area of space. So the charges there are much higher than in urgent care. So those that are looking for a lower cost alternative, evenings and weekends, urgent care is being promoted as the alternative to that. Now, if you need higher level care, certain injuries, bleeding, chest pain, things like that, the emergency room is the place to keep going for that level of care. Sometimes the public does get confused on where to present. So we'll make sure people know, heavier, more life-threatening issues continue to be in the emergency room.
The physicians, the nurse practitioners, whatever that are needed for the urgent care facility and to just generally take care of the population. Are you having any issues as far as recruiting those people into this community?
It's a national issue for recruitment. There aren't enough physicians to go around for the communities that need them. And I can say this, that for every physician we get, that comes at the loss of one or more other communities that want that physician as well. So physician providers, nurse practitioners, physician assistants are all in high demand. And we're seeing that because the population is getting older. The baby boomers are now coming into the Medicare program, 11,000 per day coming into Medicare, not 11,000 coming out per day. So that's bringing with it, as age goes along, other issues of health, and their need for more frequent health care comes with that. So there's a large issue nationally that address the capacity. So part of the capacity is to further stretch out into other providers like nurse practitioners and PAs that work with physicians to expand that capacity. So working with physicians that can have certain levels of care that are done very well with nurse practitioners and physician assistants, and then other capacity for high level care or repeat care or more chronic type issues that are of a higher level to the physician. And now it's a scheduling issue of physicians working with those other providers, physician assistants and nurse practitioners to handle the capacity.
How do you get your patients? Can someone walk into your office and say, I've got an earache, or are they referred to you?
So the patients are either referred or they can call in. So we take self-referral patients also. There are some insurances which mandate a referral. So if the insurance mandates a referral, then you have to have a referral. But otherwise, we are open to all patients. We like to provide service for anybody who needs our service.
Okay. You're watching In Focus on Whitewater Community Television's WGTV Channel 11, talking with Reid Health President and CEO Craig Kinyon and Dr. Rohit Bawa, who is with the ENT and has just moved into the new location at Chester Boulevard and Waterfall Road. We are taking your questions. You can give us a call, 973-8587, send us a tweet at WCTV Info, or send us an email, wctv@iue.edu or wctv@wctv.info. We do have a question. I believe it's a chat question that came in. What's the difference between urgent care and the clinic at Meyer, and has it proved beneficial?
Sure. There is a slight difference in the types of care that can be done in the current urgent care setting as opposed to the Meyer Ready Care. So part of that will be expanding into capacity for X-ray and things like that. So right now there isn't X-ray at Reid Ready Care at Meyer. So there's not a tremendous difference, just probably more available space for providers, and depending on the wait time, a person may be able to walk right into Reid Ready Care, or if there's a few people online, they'll have to wait longer, but Reid Urgent Care offers more capacity and more exam rooms. So it could be more of that convenience for the individual. And that was part of what we looked at, Eric, and that was some folks were getting care in the emergency department and didn't need to be in the emergency department. Others we started to see in urgent care. But even then, part of our traffic flow as individuals is convenience. So if I'm in the store doing shopping and I see the Reid Ready Care, I might remember, oh, I have to look at some things to get things checked up. And that's a prompt for people to get care. So we found that when we opened up that particular center, that it didn't just take cases from down the street and move them up to Meyer, it actually expanded capacity. That told us that people were not necessarily getting the care that they needed, or there were access issues for getting care.
Is with Meyer expanding, and they've talked about the renovation that they're going to be doing over the next 6-8 months, whatever it is, will your footprint grow?
Yes, we will be growing that space to add an additional room, looking to add X-ray there as well, and we'll continue to serve a continuing growing population that's coming into the Meyer area.
You mentioned dental. It's also something that the health department has now gone into. Is there, trying to figure out how to do this, is there something that is missing in the overall community that seems to be the push? Is it proving that there's certain health issues in the mouth that need to be taken care of that affect the rest of the body, or what is it that's driving this?
Sure. Well, Dr. Bawa can give more of a clinical explanation on the connection of dental health to body health, but it's a very direct connection. So we recognize that a lot of health issues can be not only from what we call traditional acute care issues, but also from dental issues. Infections and things like that can be from dental problems. So it's a matter of getting those addressed where people didn't necessarily have the financial resources. And our particular dental clinic is a free clinic. So it's not requiring insurance, although it's an opportunity for people that have ongoing issues to be vetted into insurance. So that may be a slight difference between how the clinic is running versus Reid. But we do see this need as being significant in our community. It's been identified in our health need assessment as an ongoing issue for dental care.
Okay. And lastly, literally across the street from the new facility, there's been building going on. I was waiting to see what went up on that location. Waiting, and waiting. Drove in, had to go to the Pizza Center recently and go, oh, it's a parking lot. It was a long time for a parking lot.
Yeah, well, there's a lot of groundwork on there. That had that large berm up on the property, so we wanted to level that out so it created better line of sight to see there's actually buildings, and people coming up that hill northbound could now know they need to turn. But the parking area is going to address the move of urgent care. So urgent care is going to bring more staff and also more patients to that location. So we're looking at how we can use that space for parking, not only for that particular building, but that entire row. The PEDS building brought a lot of capacity into that particular center. And of course, the internal medicine also has a lot of capacity. So parking sometimes always becomes the challenge.
Sure.
But we have owned that property for quite some time. It came now to the point it made sense with all the other construction going on. It was more efficient to get the work done while Dr. Bawa's building was going up.
Will it be as well lit as some of your other parking lots?
Indeed it will.
That's a particular safety issue, and I have to say, if you go to the hospital, that's a very bright parking lot.
Yes.
On purpose, I assume.
Yes.
Okay. Craig Kinyon is going to stay with us. We're going to take a break. We're going to bring out Sharrie, Harlin, and thank Dr. Bawa for being here.
Thank you.
Reid ENT, Reid Allergy, Reid Hearing Center has opened their new location, 1450 Chester Boulevard?
1434.
1434 Chester Boulevard. If you get a chance, just kind of run through and take a quick look. I think you'll like it. The pictures have been great. We appreciate you spending some of your evening with us.
Thank you.
We're going to take a break, come back. Sharrie Harlin will join us, and we'll talk about Reid Beside You, Medical Mondays, and some other things as In Focus continues on Whitewater Community Television's WGTV, Channel 11.
can sometimes be chaotic. And with small children, it can be difficult to get to the doctor.
Hi, Mrs. Towns. How are you doing?
I have a sick little boy right here. I think he might have an ear infection.
With Reid Health Now virtual visits, you don't even need to leave your home.
I'll send in a prescription for him.
Quick, easy, convenient.
I don't want to take the kids out today.
Oh, hey, Doc.
Reid Health, right beside you, right now.
Because there are dreams of what the future should look like. Because there are questions, but uncertain answers. Because there are basic needs not being met. Because physical activity should be a priority. Because every child deserves to read at or above grade level. Because you live united. A love of learning is developed. Youth value exercise. Needs are being met. Questions are being answered. Futures are no longer just dreams. Reaching out a hand to one and influencing the condition of all. Together, we can make a difference. Live united.
Matt is a survivor of brain injury.
I'm educated. I'm all about recovery and awareness when it comes to the brain.
What Matt and I will endeavor to do on this show is to give you hope.
And we're not mechanics of the brain, but I'm going to bring a lot of mechanics of the brain to you.
The Brain Mechanics, Thursday nights at 9:30 on WETV, Channel 20.
Welcome back to In Focus on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, Executive Director of WCTV, and glad you're able to join us for this live In Focus program. It will be rerun again this weekend. We'll give you those times coming up in just a little bit. You can join the conversation if you have a question for our guests, 973-8587. Send us a tweet at WCTV Info or send us an email, wctv@wctv.iue.edu. Or WCTV at WCTV.info. Hopefully I got all of those right. If not, it's on the bottom of the screen. It's okay. I'll practice and get it right over the next couple of weeks. We are joined by Sharrie Harlin. Jack of all trades is basically the title. Community Director of everything.
Community Outreach Coordinator here.
Give
me a promotion.
Out there. And Craig Kinyon, President and CEO of Reid Health, has continued to be with us for the rest of the program. Let's start by, you mentioned, we were talking, and we're going to go back just a little bit to dental care, only because you mentioned that you're not really charging people for dental care. Yeah. Do many people in the community know that?
It's free and reduced dental care, so it's based on needs that we find that are not being met elsewhere in the community. So we're trying to fill that niche. And we hope that we can also get folks that are uninsured into an insurance program, which is really a lot of what Sharrie ends up doing and trying to communicate to the public that there is a better means of access to care. And a lot of folks that can be eligible for Medicaid, not even the expanded Medicaid, but traditional Medicaid, aren't aware of that or don't have the wherewithal sometimes to see the process through. So yet they need care right now. So we want to make sure that we're not waiting for the process to go on and then take care of their health needs. So we'll intervene many times and get the dental work done now. But we want to, as a goal, move the folks into insurance that qualify for that so they have access to the entire health system.
How do you do, and I know he mentioned that's part of what you do, and I know even dating back to when the Affordable Care Act was being rolled out, you were doing informational sessions on that. There still seems to be a lot of questions from people as to if they're available to get insurance taken care of. You mentioned they may not have the wherewithal to go through the process. Do you take them through the process, and how do you do that and explain it to people in a way that they're able to understand it? Because it doesn't matter how smart you are, insurance as a whole is a very difficult thing for people to deal with.
And there are a lot of changes in insurance. So I try to go out into the community, and when we say we go out into the community, we are out in the community. You will find us at food pantries, at free laundry days, or at the Richmond Treatment Center. We have a joke inside Reid that if there are 2 or more gathered, I'm usually there trying to make sure people sign up for insurance.
Okay.
And a lot of it is just misinformation. For the expansion of Medicaid for the state of Indiana, the first time that they had HIP, you had to be married, you had to be a family, you had to have children. The HIP 2.0, there was no limit. The first time it was a limit of 40,000 people in the entire state.
Okay.
And that filled up within a matter of weeks, and there were a waiting list. So with the expansion of Medicaid, then there's no limit. And they've added the income levels. So for instance, a single person that made up to $16,400 would more than likely be eligible. And the best part of that, if you sign up for HIP Plus, then you receive medical, vision, and dental from anywhere from $1 to possibly $28 to $30 a month. So for a lot of people, that's an amazing bargain.
Okay.
And we have people to assist you. We have our eligibility company. So a lot of times I'm rounding people up, and then I pass them off to our claim aid partners. And the claim aid representatives are located within the hospital, at urgent care, as well as patient financial services at the 600 building downtown Richmond. And that's where my office is.
Okay. Another expansion that we'll talk about in just a little bit, but while we're talking about health care and you're sitting here, I have to ask, on a national basis right now, once again, a lot of conversation about the Affordable Care Act, what was good, what was bad, changes that can be made. As an administrator looking at all of this, what would you like to see our legislators on a national level do for or about health care that will either help the patient or help the cost associated with it, so that institutions such as Reid Health are able to keep things afloat? And I say that based upon the fact that you all were projected to lose $400 million or some such number like that in the last year. Sure. What from an administrative standpoint can they or should they do to make some changes that will work?
Sure. I think the analysis that we've been looking at, and a lot of hospital administrators are getting feeds from our different associations, is that there's a lot of commonality in what needs to stay. So building upon that, we know that pre-existing conditions is well received by both sides of the aisle. So that's seeming to be something that everybody wants to maintain. The other is ensuring children or children of insured parents up to age 26. So they get out of college, they may not have a job yet, or working through graduate school and don't have a job yet with insurance, and can maintain their insurance coverage on their parents' policy. So that also seems to be well received across the nation. From there, it gets into mechanisms that deal with the cost of insurance. So we know that the current Affordable Care Act plans have limitations in the sense that they only work in the state they're purchased in. So they don't have the same portability other insurance policies have. That was really not known to folks until we got into the whole unveiling of this just 3 years ago. The bill's been in place for 8 years, but the insurance didn't start until 2014. So this is really a short issue in time relative to the start of the bill, where insurance actually rolls out. Now we see what the good parts are and the parts that weren't so good. Okay. So we'd like to see a focus continuing on how to improve what wasn't working under whatever mechanism to get us to the same place. So cost has been an issue. Premiums went up. The deductibles that people were paying were a lot higher than folks thought. So you could put out a lot of out-of-pocket dollars for your deductible, your coinsurance, and of course the monthly premium to then finally get coverage. So that can only be remedied by getting more people into the insurance pool. So that brings back a focus to the penalty. The penalty for not having insurance is fairly low relative to the cost of buying insurance. So those that think that they're relatively healthy may choose not to get into the insurance pool and pay the penalty. So that hurts the insurance pool by having only the folks that are using the system maintaining their premiums in the insurance pool, which raises the costs as utilization goes up. So you have to get a lot more of the healthier folks involved to spread that cost out like any other insurance product, like homeowners insurance or car insurance. So it doesn't quite work like that. And that's something that needs to be worked out on the mechanics and economics of the premium. So we're hoping that good minds in Washington are talking to the insurance industry and trying to figure out how to perfect that and correct what wasn't working.
What's needed to make an institution like Reid Health whole? What's the most important piece of this to you all?
I think we're all on the same issue nationally to try and figure out how these changes in healthcare can be paid for, number one. Number two, the aging of the population, and talking about now we're living longer, and with that comes more health needs and health issues. So now the focus is, how do we get onto the demand side of healthcare by reducing the demand of healthcare? And that comes through prevention and wellness. In the past, that really hasn't been the national focus. So we're here for injuries and illnesses, but we always had prevention, but prevention really wasn't on the front burner. Now there's more of a national awareness that chronic diseases, preventative care, and so forth can actually reduce the cost of health care, and people feel better. It manages their health better when they can stay out of the hospital. So this has been our focus for the last 7 years here at Reid, working with our population, and it does have an impact, a positive impact on overall health. So that is a national challenge to try and make that work and get more people engaged in the prevention and wellness on their own.
I know that you've worked with Wayne County as one particular employer, and I assume that there are other employers that have bought into this, where I know that you've sent members of your staff and through the agreement that you have with them to talk to their folks about buying healthy food, how to look at labels, things of that nature. Is that part of the whole thing that you're talking about, and you all investing in that part of healthcare?
Yes, and for the employed insurance products, there are case managers or care coordinators. We know that about 5% of any health plan's population or covered lives accounts for about 50% of their health care costs. So if you can identify that 5%, the folks in that population that have these higher health needs, and better manage their health care needs, you won't take that number down to zero, but you can make it more efficient by keeping them well and at home, preventing the admissions. The admissions into the hospital are the expensive component of health care. Some of those diseases are preventable if you can get in the front end of them before they manifest into acute conditions which require hospitalization. They can be turned around. So that's communication, that's working with a care coordinator, begins with identification of those in that need. And that's where the cooperation has to come on the employer side and the folks that are covered to identify themselves as needing help. And so that's step one. Sharrie deals with this on a community level also. It's not just limited to the folks that are employed. We have a lot of folks who aren't employed and need the same level of care and assistance for similar diseases. And it's all about prevention.
Before I turn to a little bit more of what Sharrie does, I have to go one more into this. We, 3 years out of 4, have a lot of the local politicians come in and do our In Focus candidate forums. Comments that have been coming out over the last couple of years and questions that have been coming up are about payment in lieu of taxes from some of the larger not-for-profit organizations to assist with police care, fire care, some of the other services that a facility like yours would be used. And yours isn't the only one that they've talked about, but obviously because of your footprint, because of the fact that a lot of the buildings that you have been maybe used to be on the property tax rolls aren't anymore because they were owned by the physicians. You all don't live in a bubble. You hear these conversations.
Sure.
What is kind of your thought, your feeling on that whole idea and how it actually relates to reality in your world?
Sure. Well, a not-for-profit organization is a very broad category. So in there includes...
Sure, the NFL is a not-for-profit organization.
Yeah, exactly. So you have organizations like hospitals, 501c3s, not-for-profit. Churches, same designation. Also universities and so forth. State law allows not-for-profits to be exempt from property tax and also exempt from sales tax. That's a state law. That's not a local issue, that's a state issue. So you could argue the issue is more than just what you're hearing locally, it's a state issue. You can also expand it to the other 49 states in the country that have similar issues. Where we come back time and time again is to show what we're giving back over and above our tax break. In other words, what do we do as an organization to give back to the community in free care? I mentioned about dental care a little bit ago. It goes well beyond that. We have a lot of dollars in what we call assistance to the poor or charity care, and we give away dollars for free care that comes through the hospital, those folks that present to the emergency room, that have a crisis or a gigantic health need that creeps up and end up being admitted or require additional care afterwards. And we allow those patients to apply for charity care. That's, again, another thing Sharrie does as well. And then we have the folks that are on Medicaid, and a large portion of what their costs are not covered by the Medicaid program. We actually get paid below cost by Medicaid, which is better than getting paid nothing.
Sure.
But those dollars also become part of our burden for the dollars that we put back into the community. And then we have coordination of other programs with other programs throughout the entire community that we don't own, but we fund into. Some of those could be United Way agencies and different programs that are doing health-related needs. And we publish that information frequently when we run full-page ads to show the community this is what we give back to the community. That's our payment in lieu of tax that goes well beyond our tax. I'm not sure there's a lot of other organizations that are doing that to this level that Reid is. So we will gladly discuss this openly with anybody that would like to look at the data.
Okay. Since he kept turning to you and going, that's Sharrie's area, that's Sharrie's area, that's Sharrie's area. When do you sleep?
Not that often.
Okay. Let's talk about a couple of those areas and a couple of things that you do and a couple of the programs that you kind of work and run to help get some of this information out. One of the more popular ones and one that's been out there for a little bit of time is what's called a Medical Monday.
Correct.
Which you've been doing for how long now?
We're in our 4th year.
Okay.
And we started out small, and we partner with what started off trying to get a lot of different subjects out to the community. And we are now located at Central United Methodist Church, and there, we meet the 2nd Monday at 1 o'clock. And we have grown from maybe 5 people, that some months we have 40 people, some months we have 85. And it's a real enjoyable time. We try to have subjects set from medical. Then I realized I go to a lot of community meetings that a lot of people might not be aware of, so I invite the other community leaders to speak to the group so they get an opportunity to speak to people one-on-one. For instance, we'll have the Chamber of Commerce, the EDC, Anything that I think that's real important at the time that we try to bring in for the group. The mayor spoke, and then we have various departments from Reid come to present. And probably our most successful thing that happened, one of the attendees, after, I think it was a month after attending, realized they had spoken on strokes, cardiology, and the next morning she got up, realized she couldn't swallow, and that was one of the things she learned from Medical Monday. Okay. And fortunately, they got her to the hospital. She's going through therapy, and she's doing fine. She's back at Medical Monday. But those things are real exciting to see that we're making a difference. And that is sponsored through from our community benefits. So our community benefits offers a lot of programs in the community.
You mentioned your office is in the 600 building,
correct,
which is down across from Elder Bierman, for those who may not know that as an address. And we continue having people move in and move out. We say addresses they may not know. That's got to be an interesting place, because that's also where people go to pay their bills.
Correct.
And paying bills, medical bills in particular, can sometimes be a interesting experience for people. What do they need to know, generally speaking, as people come down to interact with your staff in that particular location?
Because a lot of times they're already afraid. They've been in the hospital the first time in you don't, a lot of times, unless it's a planned event, it's been an emergency, they weren't sure of their insurance, what do they qualify for? And we have a great team. Our patient benefit specialist can assist them. We find out if they don't have insurance, we have one of our claim aid reps is there to get them enrolled if they can qualify for any type of insurance, as well as we can put them on payment plans. We have financial assistance. And I always tell people, as soon as you get that bill, call us. Call us, because what it starts to happen is people wait, because they're afraid, and it turns into, then it can go to collections, and we want to work with people. Okay. And so it's kind of, I know personally I did that. I had a medical emergency and I kind of waited, so I always tell people, don't wait, call, and we would be more than happy to assist you.
You've expanded some of what you're doing. Medical Monday obviously has been here. You mentioned
correct.
Central United was at the Townsend Center. I've noticed that there are some events now taking place in Union County.
And actually, we just completed our first event in Union County today.
Okay.
So we're looking forward. We plan to go every other month, and we've been working with the Union County Health Department, as well as with our Reid office. And to service the Union County, we plan to go to some of our outlying offices in Newcastle and work with them in Winchester and Darke County and Preble County. So,
is that expansion into a more regional facility obviously on purpose? And do you feel like you're encroaching on other people's territory by doing that?
Well, I guess some people could look at it in that capacity, that there are certain areas where there are other providers. But generally what we're bringing into these communities is specialty care that is not in those communities. So we're not coming in there to compete with those providers other than provide the specialty care. In Union County, there was a very limited footprint of services. I think right now there's some in the county health department, but we're not necessarily competing. We're both trying to meet the demands of that community, correct, which are underserved. So Liberty is classified as a medically underserved community. So even with us and the county department there, they are still classified as medically underserved. Wow. Wayne County is classified federally as a medically underserved county. So when you see capacity going up, everybody needs to understand it's still less than the community needs. And that's not our numbers, that's the federal numbers.
Okay. You're expanding your outreach. We've talked about, obviously, Union County is an area that you're going into, but even locally, trying to reach out to more people and provide information. You're going to be the host of a new show that's going to start up on WETV, we think March?
Correct.
April?
Yes.
Reid beside you, what was the thought process behind beginning that show, and what do you hope to do and bring with it? Are you the new local Oprah? the medical Oprah?
Everybody gets insurance. So, but there are so many things that we do that Reid Health provides in the community that a lot of people aren't aware of. So we were hoping to use this vehicle that people would learn more about what we have to offer. So we will be highlighting the upcoming Medical Monday speakers. We want to talk about, we have a lot of free screenings, such as the prostate screenings that we provide. Letting people know about that, letting people know about, and we're always looking for candidates for positions. So we will highlight some of the open positions. So we have various health fairs. There'll be monthly topics. For instance, might be National Diabetes Month. We can bring in our endocrinologist and our diabetes and nutrition group. So I get to use my imagination. I'm real excited.
Okay. You'll be hearing more about Reid besides you coming up. It'll be airing Thursday nights at 8 p.m. on WETV Channel 20 when it starts.
And we have our first guest will be our Director of Wellness, Tawan Stoker. We'll talk about reidhealthier.org, which is a community-wide, as we're trying to get our community healthy, as well as we'll also have our eligibility group come in from ClaimAid. And ClaimAid works with various partners throughout around the country. And we've had a long relationship with them at Reid, so we're real excited. And they also work with our county health department and in Union County as well. So people are very familiar with ClaimAid. And when we say our eligibility company, we work with them to make sure and to screen people to see what insurance programs that they may be eligible for.
Because you spend a lot of your time, obviously, out in the community. That's really what you do. For you, what is the biggest misconception that you find in the community about Reid Health?
That we don't work with people, and so what I like to tell people that we want to work with you. Please come and talk to the Patient Financial Services Group at the 600 building. And we can assist you. We have found that I have to give a plug to our neighbors. We're excited. We brought over 140 people to the downtown area, and they shop and they eat downtown. And I believe Elder Bruin said some of their sales went up 25%. Because between our building, our employees going in, as well as some of our customers, our patients, when they come in, they stop in, and I'm sure even though parts of our building smells like Joanne Bakery, so I had to get used to that at the very beginning because my office smells like donuts. So I'm getting over. I'm nose blind now, but.
I imagine that move into the downtown area really has made an impact with the number of. How many people do you have in that building approximately?
About 140. About
140 people. Okay.
And because of that, I work real closely with the downtown business group, the retailers, as well as work with the Center City Development. So we try to stay very active in what's going on in downtown as well.
Okay. One of the other shows I need to give a plug to while we're talking about Reid Health and being able to reach out to the community and provide information, a program that started about 3 years ago through a grant from the American Heart Association and has continued. I Heart Cooking. Chef Dugan Wetzel, Jennifer Stockler has been a show that has really taken off. You can find it Monday nights at 9:30 on WETV Channel 20. We also have it on YouTube. We just met today, and we will be doing new episodes of that show coming up beginning in April. We'll start recording some new episodes of that one. We've had a number of people ask about that show, and that's another way for people to get information about healthy cooking, healthy eating, and that's part of what you all, as you mentioned, trying to do on the front side, prevent some of these things and get people to do some better living in general with their lives.
Yes.
I just want to add, when we first started the dental clinic, I was taking the phone calls, and I was just amazed that so many people, we were getting people who possibly had gone to our emergency department, but actually they had a toothache. And it was starting to cause other things to go wrong, and they were so thankful. The only thing is they hadn't been to a dentist in 10 or 20 years. So what we're trying to do, once again, get onto the preventative side of healthcare.
Real quickly, and I've only got a minute, so not going to do a long one, and I have to ask, there's this other building up the street, which is a lot of conversation, which people refer to as the old Reid. Obviously, it has changed hands a couple of different times.
Right.
Just curious, what is you all's thought process? Have you all been brought into conversations about what's going to happen with that location? Do you think you should be brought into conversations as to what happens with that location?
We've not been brought into conversations about that, other than the issue that we're working with the IDEM, Indiana Department of Environmental Management, is to make sure that there's nothing on that property that Reid placed there during our 105 years of providing services that is environmentally dangerous. And that is going through review right now. So we have a responsibility for that we're not going to walk away from, and we'll work with IDEM on anything and everything that needs to be done for that property. So that is our responsibility. The building is in the hands of the third owner. We moved out and left that building in move-in condition. That building was ready to go for the next resource use, and that particular company then sold it to the folks that have it right now. They pursued different options to try and develop the property, and at some point then it turned into a salvage operation. That was not of our doing. We were long since up the street when that happened. So we don't have responsibility for the third owner's damages and the way that they left that building when they left the community. We don't like it any more than anybody else does. However, if I went onto that property, I would technically be trespassing because we're not an owner.
Okay. Thank you very much. Craig Kinyon, President, CEO of the Reid Health. Thank you for being here. You've come back. Hopefully we'll get you back again before the year is up.
Very good.
Sharrie, Harlin, we'll see you in here.
We're
TV
excited.
star. Local TV star. Thanks for spending some time with us. Greatly appreciate it.
Thank you.
Want to remind you that next week we're going to have a special 90-minute In Focus. We're coming back with a bang. We have never invited the sitting Richmond Common Council to be a part of this program. We've had the candidates in as part of the candidate forum, but next week we've invited the Common Council in, and we'll see how many actually show up and have some discussion time with us. We're going to do 90 minutes with them, so get your questions ready. Also here on WGTV Channel 11, you will see this sign going up this weekend and into Monday. We have a video server that has never been worked on. Just like any place else, we have to do some maintenance, so we will not be running normal programming beginning Monday, and we think it will take 36 to 48 hours for us to get that back. We will be running the government bulletin board, but in the meantime, beginning early Monday morning, we will stop running video programming while we're undergoing some maintenance. We invite you to join us next Thursday night at 6 p.m. for another edition of In Focus on WGTV Channel 11. Thanks for watching. Have a good night.
Hi, I'm Rachel Hughes, host of The Third Sector. Join me this month and my guests, Paris Pegg from Morris and Reeves Library, and Lori Brumbaugh, and Carol Pentecost from the Centerville Library. The Third Sector airs Thursdays at 8:30 on WETV Channel 20.
You are watching Whitewater Government Television, Channel 11.